which is on zoonotic disease on small animals with One Health approach. So as an introduction, I have these pointers. Maybe if we look at the number of the dog and the cats in Ethiopia, it says that we have around 5 million dogs and 150,000 cats. And normally in Ethiopia, we kept these animals for different purposes. We keep for different purposes. So keeping such kind of animals may have a role for especially for zoonotic diseases. Maybe as you all know, the zoonotic diseases which are not transmitted from animal to humans, almost 60% of those all infectious diseases are zoonotic, and the majority of almost 75% of them are emerging pathogens. So as I said before, we kept these animals for different purpose, and they become a transmitter for many zoonotic diseases that can be a virus, or that can be a bacteria or a protozoa. For example, if we look the most common zoonotic diseases from the pet, like rabies, leptospira, brucella, toxoplasma, ringworm, and echinococcus are some of the diseases which are zoonotic. So how is the method of transmission between animals and humans, between animal and humans? So a direct contact between the household pet and the people, maybe by petting, that is by kissing or licking, or it might be the transmission could be indirectly through the contamination of the food or maybe from the environment. So transmission can be possible either directly or indirectly, but the most common one, especially for bacterial skin infections, bites are the most common. And another one is since the animal and the humans have frequent contact with frequent contact with the microbiota, which is presenting in the skin, that can also be considered as a source of infection for transmission. And another one is even the vectors like the flies can have also a role for transmission, especially for leishmania or the calazars, which is transmitted by flies like sandflies. So with that, let's have a look, the burden of such diseases, specifically in Ethiopia. How is the burden? So my intention is more of I will present the prevalence and how is the burdens in Ethiopia. So maybe can I interrupt? Adise. ድምፅህ እንትን እየረበሸኝ ነው። አስገቢልኝና ዝጊልኝ አንዴ። እየረበሸኝ ነው አንዴ። ተለበኔ ዝጊው። አስገብተሽ እንዳለ ዝጊው። Sorry for interruption. My baby was disturbing me. So if we look the rabies. So if we look rabies, as Dr. Daniel present before, each year we have almost 3,000 people are dying from rabies in Ethiopia, so which is one of the highest rabies death rate in the world. And if we look once the people are getting beaten by the rabid dogs, if we look at the post-exposure accessibility, only it is in few places it is accessible. Otherwise, in the majority of the area, there is no any accessibility for post-exposure prophylaxis. And even most people do not have good awareness to go to the hospital after they get beaten by the dogs. So generally the people awareness is very low. So let's have a look at how is the prevalence of the dog-mediated rabies in Ethiopia. This is a systematic review and meta-analysis. So in short, it's almost 72 percent of prevalence, which is really endemic in Ethiopia. So these are the various study that indicating the prevalence of dog-mediated rabies. So the overall the pool prevalence is indicating 32 prevalence, which is really endemic and still affecting the animal and the human beings as well. So the other most important one is the canine leptospira and the brucella. So as you see, how is the burden? So the overall prevalence of the brucella, for example, is around 50%, whereas for the leptospira species is almost 4%. So really, it's also endemic. Both of them are presenting. This is an indication of the zero prevalence study. So maybe this leptospira and brucella infection is really high in Ethiopia. So we need to think a possible ways for the control of such diseases. So another one is the toxoplasma. The toxoplasma in animal and in human is also highly endemic in Ethiopia. If we just directly look the prevalence of toxoplasma gondii in human in Ethiopia is really very high, up to 41%, especially for those children less than 5 years are highly seropositive for such protozoa. And if we remember toxoplasma, having toxoplasma is really a threat for especially those people who are immunocompromised, having HIV infection or having any another concurrent infections. So the other one is the leishmania. So if we look at the prevalence of the leishmania infection in Ethiopia, it's almost 92%. That's also a seroprevalence study, which was conducted in West Shoa zone. So still it is also leishmania is also presenting in Ethiopia. With high endemic. I hope you all know leishmania, that is called Kalazar. It has two forms in human beings, the cutaneous and the visceral forms, which is transmitted mainly by the sand of flies. But especially the canine leishmaniasis is the most commonly ignored or the most commonly neglected disease as well. So therefore, awareness of the people how it is transmitted is really very important. So the last one is the echinococcus. I hope you all know also echinococcus, which is a parasitic disease caused by the tapeworm of the genus echinococcus. And even this is also a zoonotic disease, and it has two forms. The cystic echinococcus, that is the hydatidosis, mainly affecting the liver, and the other one is the echinococcus, which is mainly affecting the in the lung, that is the alveolar one. So humans can get be infected by the ingestion of the parasite, eggs in the contaminated food or in the water, or it could be in the soil. So humans can easily get infection with that. So I have tried to look whether it is also present in Ethiopia. I have gotten one study which was conducted in Bahar Dar, the human hydatidosis. So almost 36,000 of patients were admitted in the hospital and examined for ultrasound examinations, and almost 24 hydatidosis case was registered. So we have also hydatidosis in the human as well. So with that, what could be the possible solutions to combat those zoonotic diseases? So what I'm thinking is that the best solution is the One Health approach, thinking in a One Health approach. As you all know, One Health approach is, there are it is a multidisciplinary approach. There are different professions are involved there, mainly the human, the animals, and the environment. So with that approaches, it would be nice to solve zoonotic diseases. Otherwise, we cannot reduce the prevalence or the incidence of those zoonotic diseases without these approaches. So we have to think a One Health approach to reduce. And so what would be the take-home message? So what I'm thinking is that we have to establish the One Health initiative that aimed to work on the pet animals. With that, we can address the issue. And another one is strengthening the Ethiopian Small Animal Veterinary Association, also another area. And maybe it's not common in our country, but especially in the Western is really very common. There are many animal activists. So even we have, especially in Africa, or it could be in Ethiopia, we need to have an animal activist who care for animal welfare as well. Therefore, advocating about the welfare of the pet animal is also very important for that. And another one is we need to also improve the awareness of the pet owner, because as I said before, pet owners, their awareness about zoonotic and the feeding practice they have is really very low. So we need to make an awareness about that. And finally, education is really very important, which has to be conducted either by physicians or by veterinarians or any other one health professionals. With that, I would like to say thank you very much for listening to me. So I finish my part.